MedNet Technologies, the innovative leader in medical marketing solutions, now proudly offers personalized medical illustration animations that instill confidence in your practice, the procedures you offer, and you as the physician of choice. Plastic Surgery and Dr. William Smith from the Smith Plastic and Reconstructive Surgery Center. Once considered exclusively for the wealthy, plastic surgery now offers everyone a wide range of affordable, realistic treatment options and corrective procedures to help you look and feel your very best. Only a qualified, dedicated surgeon with years of experience like Dr. Smith is able to evaluate and recommend the best procedures that suit your individual plastic surgery needs. A woman's breast is primarily made up of fatty tissue and mammary glands. Mammary glands drain into the lactiferous sinus, which then connects to the nipple. This is encircled by a pigmented ring called the areola. Women who are uncomfortable with the size, shape, or position of their breast may elect to have breast augmentation or breast implants. Breast augmentation is a very popular procedure for women and is among the most commonly performed cosmetic surgery procedures available today. Breast implants come in many sizes and shapes and are generally filled with saline. Today, saline implants are more often used. Breast augmentation using saline implants requires only a small incision either below the breast, along the outer edge of the areola, or under the armpit. The implants themselves are empty sacs which are carefully inserted through the incision and positioned either under the chest muscle next to the rib cage or between the muscle and existing breast tissue. The implants are then filled with a predetermined amount of sterile saline solution. After a brief period of swelling and/or tenderness, the breasts will appear fuller and more shapely in contour. The incision lines will fade or disappear over time, and the breasts take on a more natural shape. Dr. Smith is available to carefully evaluate your personal situation, expectations, and to discuss all of your treatment options. Dr. Smith's goal is to make patients comfortable with their decision for cosmetic surgery and to have them pleased with the realistic results. If Dr. Smith determines that you are at a suitable weight but have localized areas of excess fat that do not respond to diet and/or exercise and cause certain areas of your body to appear disproportionate, you may be a candidate for a cosmetic procedure called liposuction. During liposuction, very small incisions, approximately 1 inch in size or less, are made in the problematic area of the body. Next, a hollow tube called a cannula is inserted through the incision to the fatty tissue. The cannula emits ultrasonic waves that break up the fatty cells. This ultrasound device, in effect, liquefies the fat cells, allowing large amounts to be easily and safely removed. During the procedure, Dr. Smith will carefully guide the cannula, moving it around under the skin, while an attached vacuum unit suctions away the liquefied fat cells, leaving you thinner and more shapely in the treated areas. Liposuction can be very effective and can also be performed on several areas of the body at a time. However, liposuction should never be thought of as a substitute for proper diet and exercise regimen. Dr. Smith will carefully assess your personal health and goals and offer realistic treatment options. After a careful evaluation by Dr. Smith, a person may elect to have an abdominoplasty procedure, commonly known as a tummy tuck, if he or she has one or more of the following conditions: excessive fatty tissue in the abdominal region that does not respond to diet and exercise, loose or sagging abdominal skin, or abdominal muscles that have been weakened by pregnancy or injury. During a tummy tuck procedure or abdominoplasty, a long crescent-shaped incision is made from hip to hip just above the pubic area. For a complete abdominoplasty procedure, a second incision is made around the navel, freeing it from the surrounding skin. The skin of this area is then lifted up to the navel, or in the case of a complete abdominoplasty, as far up as the lower ribs, and the excess fat is removed. Stretched or weakened abdominal muscles are tightened and secured. Excess skin is then removed. As the procedure is finished, the remaining abdominal skin is pulled down over the abdomen and the incision is closed. In the case of a complete abdominoplasty, a new opening for the navel is made and secured, resulting in a thinner, flatter, more shapely abdominal region. Dr. Smith is available to evaluate, consult, and discuss all of your plastic surgery treatment options. Despite the skin's resiliency, lines and wrinkles across the forehead, around the eyes, nose, and mouth, or loose or sagging skin around the face, chin, and neck may be the result of wear and tear, overanimation, genetics, sun damage, and aging. If the appearance or texture of your skin has been affected by any of these conditions, Dr. Smith will evaluate your personal situation and may offer several realistic treatment options. One treatment option offered by Dr. Smith is microdermabrasion. This procedure is used for the treatment of aging skin, acne, and minor skin abnormalities. During microdermabrasion treatment, which generally lasts about 1 hour, a jet of very fine crystals is sprayed across the surface of the skin to remove impurities and imperfections. The discarded crystals and debris are simultaneously vacuumed into a receptacle and are later disposed. Because microdermabrasion allows for the controlled removal of the outermost layers of the skin, there is little discomfort involved and improvement in the skin's appearance can be seen immediately. Several treatments may be needed to achieve your desired results. The benefits of microdermabrasion is that you are able to leave the clinic with blemish-free, smooth, soft, brighter, and younger-looking skin. Dr. Smith will be happy to evaluate you to determine if microdermabrasion is a viable treatment option. A surgical procedure commonly referred to as a facelift or rhytidectomy is used to reduce the effects of aging and environmental effects on the appearance of the face and skin. Dr. Smith is available to listen to you and evaluate you and your personal appearance goals and offer realistic treatment options that suit your individual plastic surgery needs. Some of these aging and environmental effects may include sagging cheeks, deep folds around the nose and mouth, loose jowls or hanging skin around the jawline, loose or excessive skin and fatty tissue around the chin and/or neck. During a common facelift procedure, an incision is typically made within the natural contour of the ear, reaching around the earlobe and up into the hairline. The skin is then freed from the underlying muscle and tissues. Once the skin has been freed, fatty tissues are removed and deeper tissues may be tightened or repositioned. A face can shrink with age, and bone loss may also cause the skin and muscles to sag. In this case, a traditional facelift may cause an unnatural, overly tight, or drawn appearance. Facial implants are an option to refill those low areas, producing a more natural and youthful appearance after the procedure. Dr. Smith is available to discuss all of the treatment options for your specific conditions to provide you with the most superlative effects possible. Dr. Smith eliminates complications while achieving unprecedented results that everyone can plainly see. The choice is clear. For the best that technology has to offer, with a level of experience unsurpassed in the Bay Area, it starts with the Smith Center for Plastic and Reconstructive Surgery and Dr. William Smith.